Good morning, everyone, and welcome to our conversations on the future of work and leadership. I'm Elizabeth Varghese, and I've been talking to fellow New Yorkers over the past few weeks to get their perspectives on how life and work have changed in times of COVID. Hello, Dr. Brennan. Thank you so much for making the time to do this.
Hi, how are you? Thank you.
Dr. Noreen Brennan is a very experienced nurse leader, and she has been the chief nursing officer at the Metropolitan Hospital. Metropolitan Hospital is a municipal hospital in the heart of New York City and has been at the forefront of our efforts to fight the pandemic. Dr. Brennan and her team have been, on the front lines every day. Her record of accomplishment and experience in nursing stems over 27 years. She has a responsibility for the overall leadership and management of both inpatient and outpatient nursing delivery care for over the 300 beds at the Metropolitan. Tell us a little bit about yourself.
Sure. So I am a native New Yorker. I was born and raised in Bronx in a nice little place called Riverdale. So that's where I grew up. I decided when I wanted to go to college, so I was going to go away. So I spent some time in Pennsylvania, out by a town called Altoona, right in Loretto, Pennsylvania, which was a lot of fun, had a great time, but decided I wanted to come back to New York City. So I started my nursing career at Mount Sinai Hospital, which is our neighbor up the road, and have worked in progressive leadership positions over the last 27 years, and finally finding my way to Metropolitan Hospital in New York City. I am the proud mother of 4 wonderful children. And my husband and I have been married, and we've been married for 26 years now, and we live up in Pleasantville, New York. So we have a great life in New York. I've been a native New Yorker my whole entire life.
New Yorker, born and bred. That is wonderful.
Born and bred.
And what's the favorite part of your job? You've been in this space for a while now.
The favorite part of my job is actually seeing how my nursing staff interacts with the patients, how what we do, the knowledge we have, and the care we provide really helps them to live healthier and happier lives. When you work in a municipal hospital system, sometimes the stories are just absolutely tragic. But each day we have the opportunity to help people who have nowhere else to go.
Right.
They don't have family here. We have a lot of patients who don't have the means. Especially when it comes to money, when it comes to preventative care. But what we do here at Metropolitan is we have a phenomenal primary care practice, a great care delivery system and model. So for me, what makes me the happiest is seeing the work that my nurses do every day and how we impact the lives of New Yorkers.
That is wonderful. You're making an impact in the most profound way, caring for people who really have no other place to go. You're their home of sorts.
Mm-hmm.
Thank you for your service and for doing that. How has all of that changed in the pandemic? Can you talk to us a little bit about how your profession has been impacted?
Yeah, so the profession has really been impacted tremendously. And starting with our students, we had to suspend a lot of our clinical rotations for our nursing students because of the concern and the uncertainty as to what was going on when the pandemic really started. And for our nursing staff, I think what it did it has made us recognize that we have a great group of informal leaders who rose to the challenge. They were able to change their current roles. We broke down all of these silos. It was no longer I'm an ICU nurse, I'm a hemodialysis nurse. We were just all nurses, and we were doing what we do best, which is nursing. And we had people who were working in offices, but were registered nurses who came out of their offices and were providing direct patient care. Some people hadn't done that in many years. So we really saw people rising to the challenge. I think people inside themselves recognize that they can do it, they can get back on that bicycle and ride and take care of patients. And for me, the best thing that I saw is that people really wanted to help. Right. And that was really what came across from all of our staff. We had people who wouldn't go home. They stayed in hotels so that they could come back here and work. We had people who would go over to our respite center, sleep for a couple hours and come back. Because at the height of the pandemic, it was so tough. just putting on the amount of protective equipment that people needed to put on to care for patients. You almost felt like you were a little disconnected in the beginning, because our profession is really about touching and caring. And it's very hard when your face is covered, your arms are covered, your hands are covered. So that was one of the things we kind of missed a little bit, but we figured a way around it. We figured out how to hold the hand, how to be near the person, how to connect with them. So for us, we found new ways of doing care, which was kind of the exciting part for me.
Wow. And do you see that continuing? I mean, do you feel like some of those changes you saw in how nursing care is provided, do you see that extending as time goes on? Do you think that is, or is it more related to this particular instance in time?
Oh, I think once you've been through this experience, you're never going to be the same person again. I believe it's going to be our new normal to cutting down barriers, to really questioning, why do we do the things that we do? Is it for our benefit, or is it for the patient's benefit? And in this instance, we really, really changed our approach to a lot of different things. We changed some of the rules, we bent rules, we challenged rules,
Right.
and we really just functioned, I think, actually much better. I think our communication improved. I think the interdisciplinary collaboration between the nurses, the doctors, the essential employees, our EVS team, I mean, everybody, infection control, it has just been a whole new way to do business.
Right. So it's really brought together different disciplines. It really ensured a lot of collaboration and teamwork to get things done. And as you said, breaking rules, challenging status quo.
Mm-hmm.
So lots of breaking glass here in a good, positive way.
Yeah, and a lot of learning, because this was all new to us.
Right.
I think what we have a much greater appreciation for is the globalization of the world. In New York City, we are right near 3 major airports. So this is going to happen again. It will. It may not be COVID. It may be something new, but it is really changed the nature of how we do things and how we do our research and how we keep learning and how we keep growing.
What do you think are the skills and capabilities needed in this new environment?
So, so communication, it usually is one of our biggest faults in healthcare, but that really was key. Who's doing what, who's responsible for things. Communication is going to be great. I think we have to start looking and going back to basics. How do we make generalist practitioners rather than being so highly specialized? What we learned in this pandemic was that all that specialization, while it is really, really great and needed, that may not be what we need going forward. We may need people to be more generalist, have the ability to do different types of things, have the spirit of inquiry as well. Why is this happening? What's going on? How do I prepare for this better in the future? What we also learned is the importance of being prepared. We have a phenomenal disaster program here at New York City, in New York City itself, as well as in our hospital system. And I will tell you, we were preparing since December for this. The one thing that it has taught me is that you also have to know what's going on in not only just your general geographic area, but what's going on in the world. Watching what was going on in China for so many weeks as the news first broke, what did we learn from that? So I think also politics,
Right.
Making laws, funding, all of those types of things really, really need to be topics that all of us need to be, I think, more involved in, especially in healthcare, because of this pandemic.
Very true. We really need to have a broader understanding of all these different factors that impact the work we do, how geopolitics affects pandemics like these, and what that really means for how we do our work and care for our patients. Dr. Brennan, anything you found unexpected or interesting in this new world that you've been working in? Any story or anecdote you want to share with us?
Mm-hmm. Yeah, I think one of the most important things that we recognized is how important family is. and how important visitors are. One of the things that we recognized right from the beginning was, we saw some of our colleagues in other facilities stop having partners in when women were in labor. We didn't do that here at Metropolitan. We made sure that the partners were here during, the laboring part. We also recognized right away that, there were people that were dropping their family members off at our ED and then having no idea what happened to them.
Right.
So that was really, really key, because, I don't know how many people walk around carrying their chargers to their phones, but what we recognized right away was people had no way to even connect with their families. So we took steps to take care of that. We have a beautiful project that's a great intercollaboration here. We're actually going to patients with iPads and having those conversations so that families who haven't had contact with their loved ones can actually communicate with them, whether they're able to talk or even if they are intubated, which doesn't give them the ability to talk. So that was really good. And then, our biggest thing here that we did recognize is, unfortunately, people were going to die. And what we wanted to ensure is that the person, if they were going to die, that the family was with them. So we made a special area in our hospital for the family members to come in, to be with their loved ones. Of course, we took all precautions in terms of masks and gloves and everything else, but those things are very, very important. So we went with our values and our beliefs, and we believe that to be that important. So we made sure that got communicated as we went through. We repurposed different people from different departments, and the stories that I'm getting back from my nurses who are going into these rooms, I'm tearing up now. It's just how beautiful the stories were.
Right. Thank you. Right, you talked about what is important, family, being together, and really your values that drive how you care and work for your people. I'm getting emotional too, but I think that has really been a big part of what your team has been doing, right? The palliative care unit has really been built around that need to provide end-of-life support to both the patients and the survivors. And that is not easy to do, really, in the environment you folks were working in. So thank you for reminding us of those, very, very important things we have to hold on to as human beings. And but in closing, any message from a true blue New Yorker born in, tell us what's on your mind, what you want us to keep in mind.
Well, the first thing I want to just say is thank you. Thank you to all of the New Yorkers that have come out, have cheered for us, who have sent in supplies to the hospitals. Thank you for the beautiful cards. We have gotten some beautiful letters from across the country as well. But as a true New Yorkers, I'm going to say, look, we'll get through this. We've gotten through other things. We will get through it. It's just going to be time and patience. Remember, wear your mask. Keep your social distancing. It is helping. It is working. And I think sometimes what people don't recognize, especially when they've been home, is that it is working. We are seeing it work. We are seeing the numbers go down. We are seeing the amount of people that were intubating going down. Things are going in the right direction. And then just a selfish plug to my family. Going home, they have been just a phenomenal support to me. The people in my neighborhood in Pleasantville, New York, wonderful. Keep coming with the notes, keep coming with the funny things on Facebook. We like to laugh. It does help us, does break up the day. So thanks again.
Thank you so much. Love and gratitude to all of you. Really appreciate you taking the time to do this, Dr. Brennan.